Which of the following is the most likely diagnosis? 52-year-old woman presents to her primary care physician with a 6-month history of persistent itching, redness, and scaling around right nipple. Denies any breast pain, discharge, or palpable mass. On examination, right nipple is erythematous and has a crusted appearance. Which of the following is likely diagnosis? Okay. 6-month history, persistent itching, redness, and scaling. So this is a chronic issue, been dealing for a while. Discharge. She has no discharge, no pain, and no mass. So I'm thinking scaling around itching, redness. Oh, I kind of don't know where to go from here.
So always start right, just to kind of lead you in kind of the right mentality here. So always start with the patient's age. Is she, young? Is she, middle age? Is she older? And is it acute or chronic? Start with that.
Okay, so she's middle to older.
Okay.
It's a chronic issue, 6 months dealing with
Okay.
it.
So what
And
does that worry like just from the first sentence? What does that worry you for? So an older female, 6 months
breast
history.
cancer.
Say it again.
Breast cancer.
Yeah. So you're worried about that. Okay.
And persistent itching, redness, and scaling around right nipple. No, so there's no mass, so it's not a tumor. Well, palpable mass. There's no discharge, no breast pain. Um, I don't have a diagnosis in my head. Um,
So you started with something good, right? You said possibly breast cancer, right?
yeah.
So then after you come up with that in your mind, you ask yourself, okay, which one of these is closest to what I thought in my mind? You know what I'm trying to say?
hmm So it would be between mastitis and Paget's disease of the breast.
Okay.
I don't think it's abscess. You would feel that. Not atopic dermatitis. That's more like eczema and stuff. Not psoriasis. Again, psoriasis is pretty classic presentation. So mastitis does explain the itching, the redness, um, inflammation of the breast tissue. And then I don't remember what Paget's disease of the breast is. So just going from what we've done before, let's go with something that I do know a little bit about. Let's go with mastitis.
Okay. So I like how you worked through that, right? So Paget's disease, right? Like you said, you're going with something you know, and on a test taking strategy, that's always the best way to go.
Yeah.
Okay. So this is just expanding your knowledge a little bit, right? So you're worried if it's an older woman, right, that's had this skin issue along around her breast, you got to always be thinking there's a possibility of breast cancer, like highly on your differential. The reason why you think that is because, you never want to miss cancer, right? So in
hmm
your mind, right, already off the bat, you should be thinking, okay, breast cancer. But of course, right, they're not going to make it that easy for you, right? They're going to be like, okay, so um you look in here, right, and there's no breast cancer. That's what makes it a little bit tricky. Okay, mastitis is inflammation of the breast, right? Usually from kind of some kind of infection, right, like a cellulitis or something like that. But a better answer here that will fit is Paget's disease of the breast. Paget's disease of the breast, right, is kind of a form of breast cancer that involves the nipple and the areola. It is often associated with an underlying ductal carcinoma in situ or invasive ductal carcinoma. So remember, Paget's disease in the bone or whatnot can eventually lead to cancer. So I always remember that Paget's disease in the breast is practically breast cancer. Okay, like you said, atopic dermatitis, right? That's more of like eczema, right? So itchy, scaling, but it should go back and forth. She should have a history of allergies, things like that. So that's an unlikely. Breast abscess, right? You should be able to feel a collection of pus, right? It's usually by a bacterial infection, right? Mastitis, inflammation of the breast tissue, usually due to infection, right? Usually seen in breastfeeding women. So breast pain, erythema, warmth, swelling, right? Maybe can be fever, malaise, right? And usually it's an acute thing, not for 6 months, right? Psoriasis is a chronic thing. You get kind of demarcated erythematous plaque with silvery scaling, but it's usually not around the breast. So the best answer here is going to be the thing that is most likely or represents breast cancer, which is Paget's disease of the breast.
Got it. Okay.
Okay, so kind of what I've been realizing going through these questions with you is that your logic is very good. You follow it, right? It's just that you're not able to match what you're thinking to an answer choice, meaning that you're missing a little bit of pieces of information. Does that make sense?
Yeah.
Because if you yourself are like, oh, I know what patches disease of the breast, and I already knew prior that I was looking for something with breast cancer, then I think you would have an easier route to get to D. You know what I'm trying to say?
Yeah. And
Okay.
it still seems like I'm missing content, man.
Yeah, just a little bit. I mean, like I said, this is all touch up. You're very, very close. So